Jerry Sisemore experienced a football player's dream, a successful career in the National Football League. From the plains of West Texas, Jerry became a two-time consensus All-American at the University of Texas and was chosen in the first round of the 1973 NFL Draft by the Philadelphia Eagles. Enjoying a successful 12-year career with the Eagles, Sisemore played in Pro Bowls and in the ultimate game, the Super Bowl. In 2011, fully entrenched in life after football, Jerry faced a different kind of challenge. He was diagnosed with prostate cancer. Each year across America, 1 of every 6 men is affected by prostate cancer. Jerry Sisemore had become one of those men.
As we all know, our wives run the program, so she makes me do it every year, and the numbers began to rise. PSA numbers began to rise. And 2 years ago, my doctor calls and says, okay, we got the results back, bring your wife. You know, it's just, oh, here we go. What does this mean? And so we go in, he sets me down, looks me square in the eye, and he says, we're both going to outlive prostate cancer. Don't worry about it. You know, and the color drains out of my face, just like, what? You gotta be kidding. Look, what do I have? I have cancer? You're kidding me.
As he did while playing football, Jerry focused on finding a way to win. And after researching his treatment options, he discovered his best choice was a procedure called HIFU, High Intensity Focused Ultrasound.
The options were everything: watchful waiting, radiation, surgery, Da Vinci, Van Gogh, all those guys are involved. And but I have this HIFU, brand new stuff. The whole process of the rehab, the less intrusive, everything, Lisa was like, okay, we're all over this. You know, we'll worry about the other part of it later. And so it was a God sequence. We've talked about that many times, but it really was right place at the right time for the plan. And it all just kind of fell together in a straight, sweet line.
Now, I remember you told me that you spoke to your son, who's a pharmacist, Grant.
That's correct. He said, okay, Dad, let's tell me what it is and I'll go to work on it. You know, and he couldn't find anything but good things. So, Dad, this is, wow, if it's half of what they say it is, then you're going to be okay.
A family friend suggested Jerry contact Dr. Richard Chop of the urology team.
A real dear friend, friend of the family. She said, well, yeah, I think Dr. Chop's the one.
Dr. Richard Chop, certified by the American Board of Urology, has been a respected member of the urology team in Austin, Texas for almost 3 decades. An affiliate of the American Urological Association, Dr. Chop introduced laparoscopic surgery to Austin in 1991 and is extensively published in professional journals.
I've been lucky in that I've had along the way a little bit of a sixth sense about where things were going in urology. You know, for instance, when I brought laparoscopic surgery to Austin in 1990, the other urologists in town and even my own buddies in my practice said, you know, you can forget about that. That's never going to go anywhere. Mm. And before they knew it, we were 50 miles in front of them. So when HIFU came along, I looked at it, and I just got that good sixth sense again that this is something that's really going to be good. Folks come into our office now pretty knowledgeable about what's going on, and they know in the majority of the time, that there's radiation available, and there's surgery available, and cryotherapy sometimes where we freeze the prostate. But also, they're nervous because they have a friend or their uncle or their brother or your friend who's had surgery, and they're in the hospital for 3 or 4 days, and they're incapacitated for weeks and months, and they're incontinent, or they have radiation burns in their rectum because of this and that. And so men are obviously nervous. So I started talking to some of my friends who had done some HIFU cases, and as Dr. Suarez was saying, it sounded too good to be true. And so, as luck would have it, in the summer of 2007, I went to Cancun and got trained with Dr. Suarez, and we've been fast friends ever since. I'm now up around 100 cases, but the good thing, I think, and I tell all my patients this, is that Dr. Suarez is going to be about 9 feet away in the next room. He's going to be right there. So you've got his experience of 2,000 cases. The patients have done well, and you are exactly the type of guy that comes down there and has a hamburger after his procedure and goes home and just really doesn't have too much problems.
Dr. George Suarez of Miami, Florida, is considered the preeminent world authority on HIFU, an outpatient, non-surgical, non-radiation procedure with fewer risks of side effects. Dr. Suarez pioneered HIFU in the United States and is founder and president of the International HIFU Society. He has performed more high-intensity focused ultrasound procedures than any urologist in the world.
HIFU was available in Europe in the late 1990s. And I kept reading about it, kept seeing it, and I kept saying to myself, this is too good to be true. You and I know what a man goes through when he has his prostate removed, and the risk of impotence and incontinence and the complications. And I said, if you can remove the prostate without making an incision, that's a consequence. I knew that I couldn't practice it in the United States because it wasn't approved yet. So I had to find a place where I could put a machine. And when I was teaching full-time at the University of Miami, one of my best friends was the chairman of the medical school in the Dominican Republic. One phone call later, in 2 weeks, we had a machine. And I started treating my patients. It was almost 10 years ago. And I got to tell you, today, with the same joy that I have in sharing how well you've done, when I have patients that are 10 years out, and they are completely free of cancer, have not lost any quality of life, have remained fully potent and in control of their urine, and resumed their life in a normal fashion. That's a great story. And it's amazing that in the last 8 years, there's now over 1,000 doctors in the US and in Canada that are treating American patients. And hopefully it'll be approved within the next year. But in the meantime, it's approved worldwide. So that's why Rick and I took you to Cancun. It wasn't a bad weekend after all, right?
Oh my goodness.
1 of every 6 men in America is affected by prostate cancer, including guys as young as 30 years old. However, when diagnosed and treated early, survival rates can be as high as 90%.
But we see that the PSA screening has been a big factor in early diagnosis of patients. And where prostate cancer used to be sort of like an old man disease years ago, now it's an any age disease. And so we keep seeing a lot of younger men. Now, the key thing about that is it is that young man in his 40s and 50s and 60s that's going to live longer. And it's that young man that wants to preserve his quality of life. Prostate cancer is the most common cancer of men. So it's not like we're treating something that's very rare. We're treating something that is the most common cancer of men, the second most common cause of death related to cancer. And then on top of that, I always say, if it's not bad enough that you've been diagnosed with prostate cancer, now you have to face some potentially horrible complications, as opposed to HIFU, where you could go back to work the next day and get on with your life. A lot of people say to me, where do I have to go? And we'll say, well, you've got choices, and you don't have to go to any one place because we have options. And after I placed the first machine in the Dominican Republic, I flew to Mexico, and through professional contacts there, I picked 3 places: Cancun, Puerto Vallarta, and Cabos. And people said to me, why'd you pick those? And I said, because they're really beautiful places.
HIFU is revolutionary. It's the cutting edge of prostate cancer treatment without any cutting.
The concept of how HIFU works is somewhat new to a lot of folks. And I showed you this picture of the Lyme. I use this in saying that It's very similar to what a prostate's like. It has a green capsule on the outside, which is the outside of the prostate, and it has meat on the inside, and the meat on the inside is where the normal prostate tissue grows, and also where the prostate cancer grows. And the urethra, which you can kind of see that goes through the middle of the Lyme, is also treated. And that'll bring me to another question here in a minute. But so when I use this example, patients pick it up pretty quickly, and it's pretty simple. If we can treat all the tissue on the inside of the Lyme, then we've treated all the prostate cancer. The muscles that are responsible for continence, giving us continence, lie on the outside of the line, similar to kind of where my pen is. And so if we don't treat that, then we don't impact the continence mechanism. And also the nerves and arteries that give us erections lie on the outside of the Lyme. And so if we stay on the inside of the Lyme, usually we won't impact on those nerves and arteries, and that's why potency is involved.
The best thing is that it's completely non-invasive. I mean, when I tell patients that they're going to have an intravenous line and a temporary tube in the bladder.
It ain't all bad, guys. I mean, you can drive, I can go all the way to Dallas and back, over there and back again. I don't even have to stop and pee.
Jerry Sisemore, like many others before him, chose to attack prostate cancer through the innovative HIFU procedure. Under the guidance of Dr. Chop, he took the quick flight to Cancun, Mexico, and tackled the condition head on. With special accommodations arranged by Dr. Suarez and Dr. Chop, Jerry enjoyed luxurious Cancun quarters the evening before his treatment. The next morning, it was off to a nearby world-class hospital for his life-changing HIFU procedure.
Well, I couldn't wait. It's the Ritz-Carlton, Cancun. Oh, all right. Look at these guys. I trust them, No surgery. I mean, no stitches. No radiation, I was so excited, just whoa, I couldn't believe it. And then it just started getting better and better and better.
Jerry arrived at the hospital and was precisely prepared for the outpatient procedure.
When we pull up in front of this, it's like, wow, look at this. I said, well, that doesn't surprise me. First class, everything was amazingly immaculate. It was beautiful. Beautiful, nice, clean. You could tell it was very well run, efficient. Everyone was first class. They could speak 85 different languages. And it was the ladies, the little ladies that were prepping me for it were so kind and sweet. I mean, it's just about kickoff. And so I'm thinking, all right, this is not going to be so bad, Lord, right? And I look over there and Jorge is sitting there with the team prayer. And then Senor Ricardo is right here. I mean, it's just, let's go with this, let's do this.
In just over 2 hours, Jerry's HIFU procedure was complete, unlike the 4 to 7 day hospital stay required following open prostate surgery. Jerry was ready to fly home to Austin the next day.
And I blinked my eyes and the little lady's standing, okay, it's time to go.
I'm done.
And then Dr. Chop wants to buy you a cheeseburger. But it was the best cheeseburger I think I'll ever have. I did not hurt. I was not groggy. I was walking around. I mean, and after the dinner, after the cheeseburger, I had my smelly Shrek feet in the Caribbean under the moonlight counting my toes. This is after dinner. Day up. I got in Austin at 7, got in the car, drove around. It was a beautiful night in Austin. I was sitting out there, thank you, Lord. And I drove them all home. The next day was the district golf championship, the golf match. And I went out and did that the next day. It was amazing. And I said, Lord, I've been very blessed, very blessed. If I could just live long enough to have grandchildren. And I don't know, he said, well, big boy, get after it. And then Piper was born.
Jerry Sisemore blocked prostate cancer in much the same way he blocked opposing linemen while with the Texas Longhorns and Philadelphia Eagles, head on. And he did it through HIFU, high-intensity focused ultrasound.
Once I got over the shock, the cold, hard shock of, hey, I've got it, and the Senor Ricardo says, it's okay, you ain't the only one. Lighten up, big boy. And then, well, I can't wait to meet Dr. George and his wonderful group. And so it was pretty easy after that. It was almost immediate trust. God's sequence is a measure of your faith. It's a self-imposed scorecard. And how do you view life? What is it really about? The one thing that we're all going to do is we're going to die. And then what happens? And then you get to deal with your own interpretation of faith and right and wrong and that type of stuff. So the comfort in faith is that there are those that are with you, and as we stand and look backwards on the path that we travel, there are crossroads on that path, and it's a magnificent plan. And if you stand and watch and look and listen and feel, and yeah, that was a great day. And it's one of those things where, to me, the guy that put it out was at a perfect time in my life where I needed something to hold on to.
If I get prostate cancer next week, I'm going to be down in Cancun because I've been so pleased with how well the patients have done who have had HIFU. And so if it's good enough for me, it's good enough for them, and vice versa. So I want to thank Dr. Suarez for all the help that he's given me and all the good training. And I've always had the luck to get with the good guys right away, so it's happened this time too.
I think you're doing fabulous. When Rick called me and he said, we got the big guys PSA, I was like, oh, God, please. And when he told me undetectable and everything's working fine, I said, praise the Lord. Rick, what is his PSA?
His PSA is less than 0.1, which is the lowest number that they can put on the
The margin of error is what?
Well, if they can't measure it, they say it's less than 0.1 is what they say.
It's undetectable. I have patients from the past that regret having had surgery or regret having had radiation. I don't know about you, I don't think I've ever had anybody say, I regret having had HIFU. The scary thing is that prostate cancer treatments sometimes are worse than the cancer itself, to the point that men will risk doing nothing and risk dying of the cancer. It's the only cancer that I know where a man will say, I am willing to risk death because the alternatives that come with that treatment are worse. Mm-hmm. And there's one thing you can't take away from a man, and that is his manlyhood. Amen. And his ability to control his urine. It's over 2,000 procedures that I've done. In those first 2 years of being the only guy out there, it was lonely, but it's been worth it. When I got to the University of Miami, it was that same year that Nick Bonacani's son had the accident where it left him quadriplegic. And they started the Miami Project. And the Miami Project to Cure Paralysis is the largest such project in the world. And I was asked to participate in what was urology rehabilitation, because the paralyzed patient has no control of their urine and has difficulties with erections. So I got to know Nick very well and still are good friends. And Mark is still a patient. And so it was that friendship plus the fact that I was fortunate enough that when they had that 17-0 season, I got to go to every game. One of the things that Rick and I are doing through your help is we are offering PSA and prostate cancer screening to all the NFL members, the players, the alumni, and the coaching staff and their families. And that's because of you. You said to us one day, you have got to get this to my alumni association. And we said, why not take it to the entire NFL? So we are offering that, and you are the force that's driven that. So I think that we're lucky that we get to do that, because that's what we like doing. And sort of like, you know, football players like to play football. We like to do things that help people. And you have been a key inspiration in getting us to the NFL alumni, the NFL teams, and the word is getting out there. Thanks to you.
Number one thing, and it's very simple, but it's so critically important. Trust me on this, you need to get your PSA tested every year. It's very simple, and it's getting better and better. But every year, every male, age 35 and older, get your PSA tested. It takes about that long, and it will save you a whole lot of anxiety and heartbreak later.
Jerry Sisemore, former University of Texas All-American and Philadelphia Eagles All-Pro, discovered a new life-saving team, Doctors George Suarez and Richard Chop, and the amazing technology of HIFU, High Intensity Focused Ultrasound. If you are over 40 years of age, please have annual prostate cancer screenings. To learn more, visit these important websites: urologyteam.com, HIFUmedicalexpert.com, internationalhifu.com. And if you or someone you love are affected by prostate cancer, we encourage you to explore the revolutionary option of HIFU, High Intensity Focused Ultrasound. You don't have to lose to prostate cancer. As Jerry Sisemore has done, you can defeat it.
Let's go with this. Let's do this.